welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy, and we're talking about a bunch of different plastic surgery topics today. We're also going to be posting the doctor's phone number later, so get ready to write that down. Remember, consult your doctor before if we give you any advice. But right now, we are going to talk about arm lifts.
Okay, then.
And what is an arm lift? Is it the whole arm? What are we talking about? Because I know women are very concerned with their arms.
Yeah,
perhaps men, but what is an arm lift?
The arm, from anatomic standpoint, we consider the area between the shoulder and the elbow of the arm.
Okay.
So the lower part's the forearm.
Oh, okay.
Fortunately, the forearm usually doesn't get loose, but the upper arm does.
That's true.
When we gain weight on the arms, it tends to be on the upper part of the arm. And this surgery is done most often for people who have lost weight. So after weight loss or after bariatric surgery, if you've gained a lot of weight and the skin gets stretched out, you may have 3 or 4 times the amount of skin you need to cover the arm.
All right.
And it just kind of hangs there.
The bat wings is what we like to call them.
Yeah. If someone just has a little stuffing, then liposuction.
Really?
Is enough.
Liposuction could
but
help?
But if it's loose skin, then we need to do an arm lift, or we would call it a brachioplasty, is an arm lift.
All right. So the arm is very hard to, I would believe, to hide the scar. So how do you do that?
Well, yeah, the arm moves in every direction.
Right.
So what I try and do is keep it as hidden as possible by choosing a position that when the arm is down, it's against the body.
Oh, right.
So there's kind of 2 places I've seen people doing arm lifts. One is along the front of the arm, like below the biceps, and I think that this area is just more visible.
Yes.
And the other is along the lower part of the arm, and that's where I like to do it because it hides better. It's an area where it may not heal great, so it's something you always have to consider if you're considering an arm lift. Often with weight loss people, they can't fit the skin in a sleeve. Oh. So their goal may be completely different.
Yes.
And if they can get their arm in a sleeve, they're very
good
happy
to go.
Because they can actually buy clothes now.
All right. Let's take a look at picture number 1, shall we?
Sure. So here's a lot of extra skin.
All right. Was that bariatric? Was that surgery or weight loss surgery?
This is after probably about 7,500 pounds of weight loss.
Wow.
So a lot of weight loss. So good on them, but they don't feel like they've completed their journey until they look like they do on the right.
Is that that's a woman?
So this is a woman. You can kind of see on the before picture on the left the shape of the arm.
Yes.
And all that extra skin hanging down below.
Look at that, though. There's no scars or anything.
Well, she has a scar. It goes from the inner part of her elbow to the back of the armpit.
Wow.
And that seems to be the best place to hide it.
Looks good.
And in her case, you can see the skin kind of dips up before. That usually means the scar can stay up in the axilla. Sometimes that skin sort of connects to the side, and then we have to extend the scar down the side a little bit in order to smooth that out and lift it.
Second picture?
It's a fun job. So here's someone, most of the skin is proximal. It's closer to the armpit, and it's very full, so she still has some fullness there. And in this case, we've removed that. It gets rid of that weight, so when she's done waving, her arm stops. And the scar, again, is hidden along that lower part of the arm.
That looks great because it almost, keeps that nice shape of your arm. Whereas before, you might have to do some weights to get it back to that nice, but she didn't have much of a problem
here. I find a lot of folks who've lost weight have been exercising. They have good muscle structure underneath.
Oh, that's good.
You just can't see it. It's disguised because of the extra skin.
Because of the skin. Let's go to picture number 3. Wow, that's a lot of extra skin.
Very similar here. So this is a lot.
Yeah, that's a lot.
This is probably 4 times the amount of skin she needs. And the hard part with this is, where do you stop at the elbow? So you want to try and stop in an area where the elbow looks normal, and getting rid of all that extra skin, it does tend to leave the skin a little bit less elastic.
Yes.
So you end up with a little bit more irregular scars when it's that much of a reduction. But still, this is someone who would have a hard time wearing sleeves before.
And that looks really good.
And this is someone who did a great job losing weight. She's lost an incredible amount of weight, just has all this extra skin there.
The one before. Here's our last picture.
No, this lady.
Oh, this is, really?
Yeah, because if you look at that lower part, that skin is totally deflated.
See, that looks really good, though. Your after pick is like
now it's
phenomenal.
Because before it's
nice
very loose. She's very fit. She exercises regularly.
Yeah, you can tell.
And here I can just get rid of that extra skin, and you can see how fit she is.
All right, so downtime on the arm lifts, because you're obviously doing both. So what's your downtime?
So arm lift, usually a week or 2, somewhere in that range. It's not too long. It doesn't tend to be a very painful procedure. Because of the location of the scar, I do put a compression sleeve on them. If people have trouble with carpal tunnel, sometimes that compression and the swelling from the surgery will make it worse. For a week or so, usually that goes back to normal pretty fast.
And then, are we talking all general anesthetic?
Yes, I do this under general anesthesia.
Okay, which I guess is better. All right.
Well, it's just more predictable.
Absolutely.
And it's a long procedure. It takes several hours to do this. And it's hard to lay still that long, even if you're not being bothered.
That's true. All right, for more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web at either drmealy.com or sanfranciscobreast.com. Lots more to come on Body Beautiful. Keep it right here.